Hello, everyone. My name is Greg Puckett, County Commissioner in Mercer County, West Virginia. I also have the honor of serving as Executive Director of Community Connections, one of the 6 prevention lead organizations right here in West Virginia. This Prevention First network is dedicated to helping solve the substance abuse issues we see every day in communities across our great state. For nearly 20 years, the Community Anti-Drug Coalitions of America, or CADCA, have been a big part of my life. I spent 12 years on our Coalition Advisory Committee, and for the past 2 years, I've been honored to serve as Secretary on the CADCA Board of Directors. And tonight, in cooperation with our partners from around the country, we are honored to bring you this virtual reality naloxone training simulation webinar. You know, as many of you know, we are thrilled to join with Walmart to present this unique virtual training experience. This simulation was originally launched in February 2020 at CADCA's National Leadership Forum. And since that time, CADCA has engaged many amazing coalitions from around the country to learn how communities can host events using this technology. You know, they've had amazing initial feedback, including how to use this VR tool as a standalone awareness event and create training around it, or add to trainings that are already being held. And just as CADCA was starting to host this in person, community awareness events across the country using the VR technology, we all know what happened. We moved to virtual everything. And while we are hoping that the last half of this year might allow us once again to have an opportunity to host events back in person, we are all currently hosting events virtually. And we are thankful to the amazing CADCA members, and specifically today, thankful to our good friends, Angie Saunders, and others from the Prevention Empowerment Partnership in Cabell County, West Virginia, for being our local co-hosts. Now, before I kick off this to get to our esteemed group of speakers, I want to let everybody know the goals for today. First, we'll hear from a wonderful group of speakers right here in West Virginia, including Senator Caputo and Senator Manchin, who are working side by side on a bipartisan support of prevention services on a national level. Together, we are honored to be part of this event and working hard side by side to save lives. Then, along with the Walmart Academy team, we're going to be led by Keith Learden. We will have a virtual reality simulation that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. Now, we will follow along with the Academy lead, who will be participating in this training in a VR setting while wearing the Oculus headset. Lastly, we would love to have valuable input while learning from all of you in attendance today on how you would use this virtual reality format in your very own communities. After we hear from our speakers and see the simulation, we will have a few minutes, hopefully, for some guided Q&A. What I'm going to do is going to ask some questions at the end of the hour, and if you would please put your answers or your questions into the chat, we would appreciate that input. Additionally, in the weeks to come, we will reach out to you as a group to get more input from you as well. Now, at this time, let's move on to our speakers. First, let's start with CADCA's President and CEO, General Barry L. Price. After a decorated and distinguished 31-year career in the United States Army, General Price joined us here at CADCA nearly 5 years ago as our Executive Vice President and Chief Operating Officer. Last September 1st, he was named CADCA's 3rd ever President and CEO, and we are excited to have him as our leader. General Price is a recipient of numerous military awards and decorations, including the Distinguished Service Medal, the Defense Superior Service Medal, and the Bronze Star Medal. General Price's impact on our nation's armed forces is felt to this day. General Price, thank you for your service to our nation, and now to your service to all of our communities. I turn it over to you, General Barry Price.
Thank you for your introduction, Greg. Let me start off by saying that Greg Puckett has been a great advocate and ambassador for West Virginia, and for also being a great ally and an authentic friend to CADCA for many years. In addition to the unforgettable impact that you've had in Mercer County, Greg, you've also played a similar role as a member of CADCA's Coalition Advisory Committee, as the best ever NCA speaker, and now as the Secretary of CADCA's Board of Directors. Thank you, Greg, for your wonderful service, both to West Virginia and to CADCA. I'm excited to join Senator Joe Manchin, Senator Shelley Caputo, State Senator Ron Stallings, Matt Christensen, Jason Metzger, Angie Saunders, and Tina Ramirez today. Jeff Sargent, and other leaders from the state of West Virginia. I'm honored to join you for this training and virtual demonstration on how to save a life by reversing opioid overdose. I would like to personally thank Walmart for their investment in not only this technology, but for their investment in the people who will benefit from this life-saving training. And a special thank you to everyone on this webinar today. We hope that this unique event will train you on how state and local agencies are collaborating to combat the opioid epidemic in our communities. CADCA has a footprint in over 30 countries worldwide, and we have more than 5,000 coalitions across the United States, and in over 80 coalitions, and we have over 80 coalitions in West Virginia. We have sought to train community residents and leaders to build and develop coalitions in their communities and reduce substance use through the adaptation of CADCA's model for community change. Recently, the CDC reported that 91,862 drug overdose deaths occurred in the United States in the 12-month period ending October 2020. That's the largest number for a 12-month period ever recorded. Think about that. Almost 92,000 people died of overdoses. That number will be the fourth largest county in West Virginia, larger than the population of Cabo County, to put that into perspective. As CADCA's president and CEO, I wish each of you success in your direct communities and ask you to join me in becoming one CADCA. I cannot do this without you, and you truly are the heroes in your community. I'm excited to be a part of this event today, and with our partner Walmart, who has developed a virtual reality tool to deliver a powerful experiential element to naloxone and overdose reversal training. It's never been more important to know how to save a life, and our coalitions are at the forefront of efforts in their communities and are making a tremendous impact. I'll now pass it back to you, Greg.
Thank you, General Price. It was always, as always, it was great to hear from you, and we appreciate your time and certainly your leadership. At this time, it is my honor to introduce one of our senators in the great state of West Virginia, Senator Shelley Moore Caputo. Senator Caputo was elected by the people of West Virginia to the United States Senate in 2014 and re-elected in 2020. She is the first female United States Senator in West Virginia's history and was elected with the largest margin of victory for a Republican in state history, winning more than 70% of the vote in all 55 counties, surpassing the mark that she set in 2014 when she won 62% and also won all 55 counties. Senator Caputo has always paid attention to substance use and misuse, and soon after joining the Senate, she convened a successful drug prevention summit in Martinsburg, West Virginia, to bring more attention to this issue. Since then, she has fought for more treatment solutions and joined her colleagues in introducing the STOP Act to prevent the shipment of synthetic opioids into the United States, which was signed into law in 2018. At this time, please play the video with Senator Caputo.
Hello, everyone, and thanks so much for inviting me to speak with you today. It's no secret that the pain and scorn of the addiction crisis has touched every corner of our state. Before the pandemic hit, we were really making significant strides in finding what's most effective for our communities. Strategies like the Drug-Free Communities program employ an all-hands-on-deck approach and a reliable system that delivers results. It also gives communities the flexibility they need to meet their most urgent needs. I've witnessed the success of this program firsthand, visiting towns across West Virginia with ONDCP Director Jim Carroll. I'm inspired by the collaboration of partners like CADCA, Walmart, our state's opioid recovery organizations, and local leaders that have helped put on this event today. This program will help further educate the general public on how to provide emergency services and ultimately save lives. As more individuals receive the COVID vaccine, I'm hopeful that we can get back to making more progress very soon. In the meantime, I want you to know that I remain fully committed to this fight with you. I've seen the difference you are making in communities throughout West Virginia and so many other states. You're helping to bring us closer to a safer, healthier, drug-free nation. I look forward to helping you achieve this goal any way that I can. And thank you for all the work that you do, and have a great forum.
Thank you to Senator Caputo for those remarks. At this time, I also want to introduce our other state senator. He needs really no introduction and has been a stalwart in really working for substance abuse issues for many, many years. Senator Joe Manchin was sworn into the United States Senate in 2010, and he believes in serving West Virginia, and it is truly an honor and a privilege. Senator Manchin is committed to bringing the spirit of bipartisanship to Washington and remains committed to working with Republicans and Democrats to find common sense solutions to the problems our country faces. Combating the opioid epidemic in West Virginia and across this country is one of Senator Manchin's biggest priorities. He works with lawmakers on both sides of the aisle to secure the additional resources to fight this epidemic. He has introduced multiple bipartisan bills aimed at supporting recovery, addiction programs, and increase the access to treatment. Prescription drug misuse is still a growing problem in the nation. And in light of those concerns, Senator Manchin launched the Prescription Drug Abuse Caucus. Through this caucus, members work together with stakeholders in hopes of developing legislation and urging Congress to invest in programs that will end the ongoing opioid epidemic. Here now is Senator Manchin.
Hello, I'm United States Senator Joe Manchin, and it is a pleasure to be able to send you virtual greetings for this Community Anti-Drug Coalition of America training event. Since 1992, Community Anti-Drug Coalitions of America has demonstrated that positive change happens when all sectors of a community come together to support a common goal. West Virginia knows all too well the devastating effects of substance abuse on individuals, families, and communities. Overdoses have increased 45% in the last year. This epidemic is having a lasting effect, and we have a responsibility, especially to our children, to put a stop to this tragic issue. As drug misuse continues, more kids are being raised by grandparents and in foster care. More babies are born with neonatal abstinence syndrome. If we're going to have a fighting chance to break the multi-generational cycle of addiction, prevention needs to start with our children and youth. West Virginia is ground zero of the opiate epidemic, and I've been working to make sure that solutions important to fighting this crisis in West Virginia have been included in legislation such as the Opioid Crisis Response Act of 2018, the Lifeboat Act, and of course, Jesse's Law. The bottom line is that no single agency or organization can succeed in defeating this problem on its own. Working together, we can make a difference and better the lives of countless families. We have a great deal of work left to do, and I'm confident that we can continue to change the game in response to this epidemic. Thank you, and God bless you.
Thank you as always to Senator Manchin and also Senator Caputo. They represent us well at the national level. You know, and West Virginia is very blessed in many ways to have representation all the way down through our state and local communities. One of the greatest champions that we have in the state of West Virginia is State Senator Ron Stallings. He has represented West Virginia's 7th District since 2006. He attended Wake Forest University and went on to earn his Bachelor of Arts degree and then on his Masters of Science from West Virginia University. He then received his MD from Marshall University School of Medicine and is a physician. For over 35 years as a physician, he has been on the front lines of the opioid crisis and sees personally how it is affecting West Virginia and our country. He believes we must get a handle on the opioid and substance abuse crisis if West Virginia is going to move forward as a state. And now we will all hear from Senator Ron Stallings.
Hello, my name is Senator Ron Stallings. I am a physician, internal medicine, and geriatrics in Southern West Virginia. I'm also a West Virginia State Senator for the past 15 years, and I have chaired the Senate Health Committee. I've also worked with the Council of State Governments. And again, when we talk about substance use disorder and recovery, it's a huge issue. And in fact, it's going to be hard for us in West Virginia to turn our state around until we really get our handle on it. So over the past several years, we tried to pass legislation that would curb the amount of opioid prescriptions. Some of those things had unintended consequences when we went after the pill mills, if you would. We didn't have recovery in place, and so a lot of the patients went over to heroin, and that resulted in a terrible increase in our overdose deaths. Over the years, we've tried to get naloxone or Narcan more readily available. Initially, it was by prescription. Now you can pick it up at a pharmacy. You don't need a prescription now in West Virginia to have that. West Virginia has really led this, I think, the country in many ways through Huntington has really worked hard. And we absolutely need to keep moving. Recovery, of course, is so important. And we have to reintegrate these folks back into the community and workforce. One of the things that we have in West Virginia is called Reintegrate Appalachia. That incorporates employment, transportation, housing, certificates from community and technical colleges, personal development, and accountability. We need to listen, of course, to the folks on the front lines, our law enforcement officers, physicians, nurses, mental health providers, and we have a true workforce issue. We need to better compensate folks in the counseling so that they go into this. That's a real area of weakness. We need to think about social determinants of health and how we deal with the stigma of addiction and people in recovery. Again, take some of our really great things that are working in West Virginia, such as the Provider Response Organization for Addiction Care Treatment, PROACT. It includes quick response teams, peer recovery programs, naloxone, community training, drug recovery courts, community-based services, all those things that would really, if we could get those statewide, it would really matter. We passed a bill that limits initial prescribing so that people who are opioid naive doesn't get started on these, because we know now that the risks of addiction is very high. And even though some people absolutely need to have pain medicine, even narcotics, certainly you want to limit those as much as you can. The other, Tylenol doesn't work well, and non-steroidals are pretty hard on people, particularly seniors. So patient selection is very important. But we really need to deal with stigma, and we really need to look at addiction and recovery as a long-term integrated process. And it's an illness, not a flaw. Thank you very much, and I look forward to working with other people as we go forward.
Thank you, Senator Stallings, for your remarks. Indeed, we have a lot of work to go, but we also understand the power of addiction and how we must overcome that. Next we have Dr. Matthew Christensen, Director of the Office of Drug Control Policy for West Virginia Department of Health and Human Services, who plans and directs West Virginia's efforts in combating the opioid epidemic. He was appointed to this position in October 2020 by Governor Jim Justice. Dr. Christensen is a dual board certified in addiction medicine and family practice, and serves as an associate professor for Marshall University Jones C. Edwards School of Medicine, Department of Family and Community Health, Division of Addiction Sciences, where he practices primary care and addiction medicine. Prior to his appointment to the Office of Drug Control Policy, Dr. Christensen was active in treatment of addiction and dependence across the lifespan. He has lectured across the tri-state area on addiction issues from a public health and a primary care perspective. Dr. Christensen, you have the floor.
Hello, my name is Matt Christensen. I'm the Director of the Office of Drug Control Policy here in the great state of West Virginia. And I want to thank you for your interest in the life-saving drug naloxone as a safe, effective reversal agent for opioid overdose. In 2020, we saw a dramatic increase not only here in West Virginia, but across the nation in substance use, and unfortunately saw the highest rate of overdose deaths that we've ever seen. And when we see these numbers, it is so important to remember that these are fellow Americans and West Virginians, brothers and sisters, mothers and fathers, employees and employers, friends and neighbors. Adequate access to naloxone could help change the trajectory of this epidemic and help others enter into a long-term life of recovery, as it has for so many of our other fellow Americans and fellow West Virginians. Here in West Virginia, we're happy to say that we're committed to expanding access to evidence-based treatments, including access to naloxone. We've hosted Save a Life Days to get naloxone out to community organizations, have expanded programs to get naloxone to treatment programs, correctional facilities, quick response teams, emergency medical services, fire, police, and other first responders. We've also worked to change the standing order for naloxone to allow more access for community groups. Now, the proof is in the pudding. Here's the naloxone I carry with me at all times. This box has certainly seen better days, but it's important to see naloxone as you would a fire extinguisher. It's great to never have to need it, but if you do, you'll be glad you had it. I challenge you to go to your local pharmacy, healthcare provider, or health department and ask how you can get a dose to carry with you in case of an emergency. Or better yet, start a naloxone community group where you can distribute naloxone to save your friends and neighbors in need. Together, we can change the face of this epidemic. Thank you.
Thank you, Dr. Christensen, for taking the time to be part of this event, for everything you do every day for West Virginia families. Next, I want to introduce a very close friend of mine, somebody I've known for many, many years, Angie Saunders. Angie is the director of the Prevention Empowerment Partnership, an initiative of the United Way of the River Cities, where she directs and coordinates various prevention efforts for Cabell County and the 4 additional counties in the United Way service area. She administers local, state, and federal grants, including the Opioid Affected Youth Grant from the Office of Juvenile Justice and Delinquency Prevention, the Drug Free Communities and CARA grants from the Federal Substance Abuse and Mental Health Services Administration. Sanders, her staff, and more than 75 volunteers support the work of Prevention Empowerment Partnership and its subcommittees, including the Cabell County Substance Abuse Prevention Partnership, the Community Outreach and Training and Education Subcommittees, to increase the access to prevention services and contribute to the full continuum of care for substance use disorders in the River Cities. Angie has over 25 years of experience in justice prevention and community development related issues and has provided consulting services for many years, including training, technical assistance, and grant writing. My friend, Angie Saunders.
Hello, I'm Angela Saunders, and I'm the director of the Prevention Empowerment Partnership, PEP, housed right here in Cabell County. First, I'd like to say we are honored to partner with CADCA and Walmart on this naloxone awareness event. And we are thankful to our state and community partners for their collaboration and support. PEP is a fairly new coalition. It originated as CSAP, the Cabell County Substance Abuse Prevention Partnership, which still exists as our Universal Prevention Subcommittee. But through an array of diverse funding sources, was expanded into PEP to include different types of prevention strategies, including community outreach, training, assessment, and evaluation. We provide comprehensive evidence-based prevention strategies and have a strong dedication to youth engagement, peer-to-peer learning, and empowering youth to be prevention advocates. PEP has embraced the use of technology to provide services and was named the SAD National Partner of the Year in 2019 for its use of technology with youth engagement. But we were just getting started. As the pandemic disrupted and changed all of our lives, we at PEP realized we couldn't just pretend that prevention for youth could be put on hold. Because we know our community and we know our kids, we realized that our most vulnerable youth were being put at an even bigger risk because of the isolation. So we got busy and created an extensive youth engagement program that operated virtually throughout 2020. We tried a lot of different platforms and worked around the constraints of COVID-19. And what we found is kids love and respond to the virtual world. And although we know they still need their protective factors, meaning all those things that provide strong community and school attachment, we could still reach and interact with youth through technology. I would love to tell you all the details of the accomplishments of our youth and PEP during the pandemic, but that would take just too long. So I will just ask you to visit the website to learn about their PSAs, their training workshops that they helped develop and presented to professionals as well as an entire school district. To read PEP's quarterly newsletter, The Voice of the Youth, written, designed, and produced by our youth. And tune in to our social media platforms to see all their activities and the other uses of technology. The pandemic forced us to learn how to better reach your youth virtually. And although there's a lot of things that we would gladly forget about this past year, that is something PEP will not forget. That is one of the reasons we were also interested in participating in this event, to share with you the new virtual options that coalitions may use to provide education to adults as well. We get to do rich and exciting work like empowering youth to change the future of substance use. But we also serve our community by analyzing the data and implementing evidence-based strategies. We look to our federal and state partners and apply their research to our communities too. So as we watch the data, we learned the pandemic was not only removing the protective factors from our youth, but it was also wreaking havoc on those with substance use disorder. Overdoses skyrocketed, with over 81,000 drug overdose deaths in the US in 12 months ending May 2020, the highest number of overdose deaths ever recorded in a 12-month period. We learned that synthetic opioids, primarily illegally manufactured fentanyl, was the primary driver of the 38.4% increase in overdose deaths. At home in Cabell County, internationally known as the capital of the opioid epidemic, since in 2016, when 26 heroin overdoses were reported in a 4-hour time period. The 2 consecutive years of decreases of fatal overdoses returned to the 2017 levels. 1,275 West Virginians were lost to fatal overdoses, and 85% involved an opioid. Cabell County lost twice as many people in 2020 as they did in 19. Along with 4 other counties, Cabell County led the state in the number of fentanyl-related fatal overdoses per capita in 2020. Clearly, overdoses are on the rise nationwide and right here at home, according to the CDC. So what can we do? Continue our prevention efforts with youth, learn about treatment and recovery in our area, and you're going to hear about that from one of our most valuable partners, Great Rivers, up next. Dispose of dangerous medications in your medicine cabinets promptly and safely, and as the CDC recommends, learn more about the life-saving antidote for opioid overdoses that has been around since 1971, naloxone. Learn how to use it and where you can get it. And that is part of why we're here today. The links for the training and distribution, prevention, and drug take-back sites are on your screen. Please consider carrying naloxone. Remember, saving someone from an overdose prevents death and provides an opportunity for treatment and hope for a better tomorrow. Thanks.
Thanks so much for those remarks, Angie, and for your friendship with CADCA and the really impactful work that you're doing right here in West Virginia in Cabell County. As she alluded to, we also have the honor of being joined by Tina Ramirez tonight. As the director of the Great Rivers Regional System for Addiction Care within the Marshall Health Division of Addiction Sciences, she has built an infrastructure and strengthened collaborations in the communities and neighborhoods hit hardest by the opioid epidemic in West Virginia. Those include Cabell, Jackson, Kanawha, and Putnam counties. The components of the system that she coordinates include public health harm reduction programs, offering syringe exchange with wraparound services, community-based quick response teams to visit individuals following overdose events, hospital programs to identify and link individuals with substance use disorders to treatment from the acute care setting, and naloxone education and distribution, and a mechanism to coordinate all of these services as a true community-oriented system for addiction care. This program is building and strengthening infrastructure to have measurable impact and saving lives and changing the course in the future of individuals, children, and families impacted by the opioid epidemic in the Great Rivers region of West Virginia. Tina Ramirez.
Thank you for having me and for heading up this very important initiative. I'm proud to be part of the partnership with CADCA and Walmart. Great Rivers Regional System for Addiction Care is a systems integration grant funded by the Merck Foundation and housed right here in the Addiction Science Division of Marshall Health. We use innovative approaches to address addiction and recovery efforts here in West Virginia. One of the main goals of the project is to reduce opioid overdoses and overdose deaths. We work with comprehensive programs in and with local communities to harness the expertise of multiple partners, including healthcare providers, public health experts, first responders, and community-based organizations like PEP. Another focus of the project is to reduce stigma that surrounds those experiencing substance use disorders, their families, and friends. This includes reducing the stigma that surrounds naloxone and also increasing access to naloxone. We partner with many different entities in the local trainings and dispense naloxone kits. After the trainings, participants understand the signs and symptoms of an overdose, strategies to prevent overdoses, how to administer naloxone properly, the reporting requirements related to the use of naloxone in West Virginia, and local addiction counseling and treatment resources. Great Rivers has developed an app that's available to Apple and Android devices that have links to all of those resources in one location. We also partner with different state leaders throughout West Virginia to coordinate Save a Life Days. And those are events where we go into the communities and educate them and get naloxone kits out to those who need it most. Luckily, we've had great success and thousands of kits have been dispensed through those events. We feel that naloxone really should be in all first aid kits and available to anyone who is at high risk for opioid overdose. Great Rivers stresses to the community that the only requirement to get someone who's experiencing substance use disorder into treatment is for that person to be alive, and naloxone helps make that possible. We have a This Is My Story campaign where we featured over 40 individuals who have overcome addiction and are making a difference in our communities. Many of those, their lives have been saved by naloxone. These stories can be found on our website. It's much better to have naloxone and to never need it than to need it and not have it. Substance use disorder doesn't discriminate, and you never know when you will save a life just walking down the street. The only thing that naloxone enables is breathing. Thank you.
Thank you, Tina, for helping us to better understand some of the tremendous work that's ongoing there in Great Rivers and throughout the state of West Virginia. You know, and finally, tonight, we'd like to share one additional very special guest before kicking it over to the Walmart team. Jeff Sargent is a carpenter local to Huntington and is a single father of 3 children. His family's direct experience with naloxone has led him to engage in opportunities to talk with his neighbors about the importance of access to naloxone and hope it provides much more information to all community members. You know, Jeff is here tonight to tell us a story about the role naloxone played in his family's story. Jeff.
My name is Jeff. My son was a heroin addict for 4 years, and they used Narcan. He had overdosed, and a girl and a gentleman that had taken him to get it brought him to the hospital, and they had to carry him in. He was blue, not breathing, not responding, and they gave him Narcan. The nurse did in the lobby, which didn't help right away until they took him to the back, and he had to be adrenaline and electrical shock to get his heart started because his heart had stopped. And then they gave him the Narcan, and that brought him back to life after that. And without the Narcan, I wouldn't have my son today. And because of him, I now have a grandson, and it saved his life. And I don't know what I would have been if I'd lost him, and or where I would have been. But it was a really tough time, and it was tough to watch him go through that and recover. But without the Narcan, he wouldn't be here today. And it's, I think, a wonderful drug. and I've witnessed other people that have been Narcan, and it's excellent product, and I don't know how you could do without it. And he's given me my son, and I wouldn't have him without it. And it makes me extremely happy that there's products of this nature that are out here to save people. And I think they should be used on a regular basis. It's a very good thing, and it needs to be spread for more people to have access to it, to use it, so they can save more lives. And it's wonderful. And it is, like I said, I've got a wonderful grandson because of it, and I watch him every other week, and he's a blast. And it's really gave a good future to him, to me, and to all of our family members, to can all get to enjoy him and my grandson still being here. And so it's a great thing. But I don't know how much more I can express. Thank you.
Thank you, Jeff, for your very touching message. You know, we have some good success in the fact that we know that Jeff's son, Corey, is currently a community health worker and a peer recovery coach with Great Rivers. So again, Jeff, thank you. Without any further ado, I want to turn it over to the Walmart team to introduce their fantastic virtual reality product. Keith, would you like to say a few words?
Absolutely. Thanks, Greg. My name is Keith Learden, and I'm a senior manager with Walmart's Academy Operations Support Team. Walmart has invested in our associates by creating the academies, which are dedicated facilities for hands-on training that combine classroom and sales floor training for our associates. The academies also partner with our communities in various ways to provide continuous learning opportunities. One of the ways that we can provide content for our participants and our community partners is through virtual reality. VR helps us recreate situations that aren't easily replicated in the classroom or on the sales floor. So I'm now going to turn it over to the Academy team in our Barboursville, West Virginia Academy, who's going to demonstrate how we leverage VR. So Kim, Adam, over to you all.
It's what I just swiped for my grandma.
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today, we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey, you okay, dude? You don't look so good.
opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911 with the emergency. Yeah, hello. I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you'll see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? In 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. No. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me. All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor. This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you very much to the Academy team for helping to put together the demonstration today, and also so much to Walmart for hosting us, and for all of the speakers here today who have taken time out to be part of the event. You know, we do have till about 7:30, so we have about 10 minutes in which we can get some feedback from the participants tonight. See that there's probably 25 or so that are online. If you'd like to go ahead and put some comments from the participants, we can do some quick Q&A, and I will ask just a couple of questions to our viewers here today, and you can respond also using the chat. But we've only got about 10 minutes left, and so I know we're going to get a lot of amazing feedback either now or perhaps later. So please know that we're monitoring the chat, and we'll be willing to give all the up-to-date information in perhaps now or either separate conversations as well. So if we don't get to you, and we do definitely want to hear from you, and providing more opportunities to learn. So all of you have the opportunity right now to raise your hand. You can unmute for comments. So let's see how many we've got here. We've got several in. We have 26 attendees. So does anyone have any comments, questions, thoughts? Feel free to put those in the chat. I know one of the things that we've talked about is what is the best way, and a suggestion of how we could use this VR simulation within the state of West Virginia in our current work. You know, we do have our prevention lead organizations scattered throughout the state. All of our communities have a community-based coalition that are working with this. Certainly, you know, we've looked at various options, but how would we use this within the state of West Virginia? And again, the chat is open to anyone who would want to participate. Getting one here that says, yes, college programs would be very important. I know we have the West Virginia Collegiate Recovery Network, and I think they would be fantastic. Let's see, Virgil says, how are the youth engaged in this work with Narcan? I do know that, you know, within the state of West Virginia, there is a lot of great work going on with the coalitions. You know, we do as much as possible to train and educate through our quick response teams, but really it's our coalitions that are constantly working with our young people to educate them the harmful effects of opioids to begin with, and also knowing how to use Narcan. Also, there are several quick response teams around the state that go out and do continual education to community-based groups, be it churches or through our, you know, even our jail system and so on. So I think there's a lot of really good good feedback there. I'm looking down through to see if I see any more. I know that we had also talked about, you know, there were several things that the general population, of course, need to be trained. But, you know, most of the time, you know, we do have possibly a stigma that's attached. And so how would the folks here, yes, volunteer fire departments, those are good. But, you know, we do have Stigma-Free West Virginia, which is a great program to help educate the folks around. What other gaps or possible sectors do you think we could use? I'll take any comments to the side or to see. Who should carry Narcan? Should I carry it only if I have an opioid prescription or know people who use drugs? Honestly, from our work that we do here in the state of West Virginia, I would say that everyone should carry Narcan. We are working very hard to make sure it's readily available at all times. And we would like to see it even put into our grocery stores, our convenience stores. We've also talked about, you know, if there's an AED machine somewhere, be it in a school system or wherever it is, there should also be a Narcan kit. Cash prices for naloxone are very high and remain a barrier for most. Is there an existing long-term sustainable funding source available to provide naloxone for free when not covered by insurance? The answer to that is yes. Currently, through the state of West Virginia and through the University of Charleston, there is a lot of ways to get naloxone through community-based outreach. We have many of these programs that are involved, so I would recommend using your local community-based coalition. If you're not aware of where to get that information, I would go to helpandhopewv.org, and you can find the latest coalition in your community. So definitely do that. There is naloxone available. It is for free to anyone who wants to do that. Let's see. I have naloxone that expired last month, not used. How do I dispose? From what I've been told, don't dispose. I would reach out just to make sure. But from my understanding is naloxone has a longer than documented shelf life. You may want to get an extra kit to carry with you, but it's my understanding that the naloxone still will exist past its expiration date. Do check with your local health professional on that, please. But I do recommend that. And I would not dispose just because you've got it and it's expired. Let's see. How are you working with realtors? Great question. I know in the state of West Virginia, there have been a lot that have been working with our local realtors because of the way that people are coming, going, looking in houses while they're trying to sell, maybe rummaging through the medicine cabinets when they go to tour a home. I know here in the southern part of the state, we have worked with the local Realtors Association within our local community coalition. Let's see, Save a Life Day. Great Rivers is responding. Many counties on September 1st. Final details pushed out in the Great Rivers regional system. Please check out that. And we will post these back as well. If you're unfamiliar with Great Rivers, check out the helpandhopewb.org website, and it will link you up to Great Rivers. Let me see if I've got any more here. Professional students like pharmacy, medical, and nursing would also be a great audience to educate and help reduce stigma surrounding naloxone. Yes, you're correct. And I will say that through the Collegiate Recovery Network headed up by Susie Mullins, that is a great way to reach that student population. I know that, again, the University of Charleston is doing a phenomenal job at getting naloxone out on the street and also using that as a teaching tool to all of our new pharmacy students. Let's see, Anne said, I contacted my local health department to replace my expired Narcan. I was told I could use it for up to a year. Yes, thank you so much, Anne, for responding back to that earlier question. Still having issues with pharmacies filling the standing order for Narcan in many rural areas. Kimberly, I'm not positive where you're from, but if you'll put your information into the chat, we can get back with you on that. We could probably work to see what pharmacies may not be complying or doing that, and we may be able to reach out to them with the your Nicholas County. Okay, we may be able to reach out, and here in the southern part of the state, we have a coalition engagement specialist. Her name is Liz Brooks, and we will have Liz reach out and on your behalf, and we can work with her. So please put your information into the chat to contact, please. Let's see. Contact here is we would love to learn about delivering this training in other languages. I think that would be a great idea. You certainly, the more diverse we can open this training up, the better. We have about 2 minutes left of this session. See if we have any more joining into the chat, any more questions, comments. Kimberly, thank you so much for putting that in there. Try to see if there's any more here. We also did say, I know we talked about, the fire departments, volunteers, so on. One of the things that I know we've done a lot of, and I think we've seen success, is because we've been able to get Narcan from the University of Charleston, many of our coalitions are reaching out through different education venues, non-traditional health fairs, county fair, state fair, PTA meetings, back to school events, church events. All of those things are great to have. Again, if you're looking at who can get that information, we want to get this out to our schools. One of the other things we've talked about is working through our daycares. Currently there is a daycare system in the state of West Virginia where we can actually help provide education through those daycares. We can actually provide stipends to people wanting to put their people in daycare. And so there's an opportunity there to get some additional education on Narcan as well. A copy of this recording. It's my understanding is that this is being recorded, but there are still going to be some issues trying to get that out. We are getting clarification, is in cooperation with Walmart and CADCA. Great job on the PEP presentation. I agree. Thank you so much, Virgil. And definitely, I would say go ahead and reach out to the CADCA team. At this time, we have about 1 minute left. We are through with the hour, and I want to extend our thanks again to all of our speakers and participants for attending the event. We truly appreciate your time and insight. Please reach out to CADCA at any time at www.cadca.org with more suggestions and questions, and look to CADCA to be reaching out to discuss this matter more and to get more tremendous feedback. We are now going to conclude this evening. We appreciate your time. We hope you all had a wonderful, long, restful weekend coming up. And I know that we'll take some time to remember and appreciate all of the people who have served and currently serve our beautiful country. Thank you again to everyone for joining us tonight. Have a great one.